Hello again. One more part to this. This is Unit 1, number 4, part number 4 here. This is on the nursing process and client teaching. This is in Chapter 2 of your book, starting on page 14. We're going to talk about the nursing process, and again, we're going to start with the assessment. The assessment is full of the subjective data. This is looking at the current health history. Why did the patient come here? What happened to bring the patient there? What are their symptoms? What medications are they been taking prior to them coming? What is the past medical history? Do they have hypertension? Do they have heart disease? Do they have diabetes? What is the environment? Where do they live? Where do they work? Are they married? Do they have children at home? What's their primary language? And how are we going to communicate with this patient? So that's the assessment part. Then in the other part to the assessment is the objective data. That is your physical findings, the things that you see when you look at that patient. Are they diaphoretic? Are they pale? Do they have dry mucosa? What's their vital signs? What's their heart rate? What's their blood pressure? What's their temperature? Are they feverish? Are they cold? Are they tachycardic? Then what were your lab tests? What did your lab tests show you? What was their sodium, their potassium? What is their BUN and creatinine? Looking at those. What is their hemoglobin? What is their white count? Did we do a differential? So we need to know those things so that we can tell what's going on with this patient. The other thing is then the diagnostic studies. Did we get a chest x-ray? Have we done a CT scan? What other things are we finding when we do our objective data gathering? Some of the common nursing diagnoses related to drug therapy are a knowledge deficit about the drug action, about its administration, and what side effects can be expected. Some of these may be related to a cultural or language barrier. So you would say knowledge deficit about this drug due to cultural or language barrier. Another common diagnosis is non-compliance related to forgetfulness. Do they have some dementia taking place? Are they forgetting to take their meds? Have we got the drug regimen set up in such a way that it is inconvenient for them compared to their lifestyle, so they forget to take their medication? And then if they're forgetting, it's not going to help them. So we need to look at those issues. Or ineffective therapeutic regimen management. So just maybe it was ineffective. It was drug, we need to change drugs. Maybe we're having issues where tolerance has taken place. So in our planning, then we set up goal setting. What are our goals going to be for this patient? Now that we've assessed our situation, now we have to make a plan. For an example of this is given Planet EV will independently administer a prescribed dose of albuterol by the end of the first session of instruction. Well, albuterol is an inhaled medication. It's used in one of those MDIs, those multi-dose inhalers. And so we're going to have to teach this patient. But our goal now for this patient is that they will be able to administer this drug by the end of the first session of instruction appropriately. So that's our goal. So then in planning, we also have to look at the characteristics. So our goal for this, it is clearly stated that we are expecting a change. It is client-centered in our plan. It's realistic and measurable, and it has realistic deadlines. And for a goal to be good, it has to have all of those issues. It has to be looking at the client. It has to be clear. It has to be realistic and measurable, and it has to have a deadline or a goal, end goal. So now we're going to implement. And to implement it, this is when our nursing actions actually are started to reach that goal. So we're going to do our client teaching. We're going to talk in general about what the client needs to know. We're going to talk about the self-administration. We're going to talk about diet issues related to that. We're going to talk about side effects that may happen. And we're going to have to look at the culture that the patient is living in to be able to think about what other considerations we need to think. we need to remember to, as we're pointing out helpful points to remember, is to take medication as prescribed by your healthcare provider. So that's the main thing. We need them to take the medication as it was prescribed by the provider, whether it be the physician, nurse practitioner. And if they don't understand it and they have questions, they need to call. So that's the first thing. They need to understand that you need to do what they're asking you to do, but if you don't understand, call. You want to always keep the medication in the original labeled container and store it as indicated. Always keep meds out of reach of children. And if they're grandparents, you got to remind grandparents and their visitors to monitor their purses or their luggage when they're visiting, because that's a source of child inquisitiveness. You need to before using any over-the-counter drugs, including aspirins or laxatives, etc., anything like that, check with your healthcare provider to make sure that they are not interacting. If you don't talk with your physician about this, you can always talk to your pharmacist. The pharmacist is a good source to ask before you buy a product, and or if while you're using it. But if you're in the pharmacy and you're thinking, I think I need this laxative, go over to the pharmacist and they'll be glad to talk to you about whether or not it interacts with something that's already being taken. So make sure and get that point across. And when you go to your doctor, make sure you tell your patients, when you go to see your doctor or you come to the hospital or anything like that, bring your medications with you. If you don't have a complete list of them, bring your medications when you go there, and then they can at least kind of go through everything. And a lot of times that's a good way we find as healthcare providers, we find they're on so many different drugs because maybe they've gone to several different doctors, and so they've got different drugs that probably shouldn't be given with each other, or they may be taking two of what is being prescribed. So that's just a good practice to always make sure to tell your patients, please bring all your medications with you when you come. Another one to remember is know why you're taking each medication and under what circumstances, so to notify the doctor or the healthcare provider that you're having an issue. That's another thing you really need to get across to them. Like I've said, we'll find out that there's multiple. They'll have be taking drugs from different doctors, and they probably shouldn't be taking them together. Another thing is alcohol. You'd be surprised some of the people that you are taking more than their amount of alcohol. And alcohol may alter the action or the absorption of a medication. It may make a person more, the analgesic they take a little stronger, or it may not absorb as well. So these are things that need to be discussed. And you need to discourage alcoholic beverages anytime you take your medication, and it's absolutely contraindicated in certain medications, so that's something that needs to be discussed. Smoking tobacco also alters absorption of some of the medicines, like theophylline type medications, tranquilizers, antidepressants, and pain meds. So these really alter that absorption, so they're not really working well. So you need to consult a pharmacist or your healthcare provider to get good answers on that. Then a checklist for health teaching and drug therapy. So when you're getting ready to go in to teach this person about their drug therapy, you need a comprehensive drug and health history. You need a reason why the medication is being given for therapy, what you expect your results to be, what your side effects or adverse reactions may be, when to notify the healthcare provider or pharmacist, and then understand the drug to drug, the drug to food, the drug to lab, and the drug to environment interactions. So that's some of the things you need to be talking to your patient about when you're going to do some education on your medications. Luckily, in a lot of facilities anymore, there are some wonderful handouts, and they are in multiple languages that you can use to help with this educational process for your patients. So not only then do they get the verbal discussion of this, they also get a take-home or something in their hand that they can actually read. Any you want to be sure to teach anything about that's requiring changes in their activities of daily life. Maybe they need to take this pill on an empty stomach first thing when they get up in the morning before anything else has changed. So things like that. And when you're teaching, you can't always just do the talking. It's best to do several forms, such as listening. Listen to what they're saying to you. So maybe there's something we can do to help them understand it a little better. A return demonstration is always good. Especially like if you're teaching insulin administration. If you're teaching a first-time diabetic, a new onset diabetic, how to deliver insulin to themselves, that's something there has to be several study sessions, plus there has to be a return demonstration by them, because just you showing them will not make sure that they understand what they're supposed to be doing. And then a medication schedule. That has to be you're looking at their activities that they do daily and associate that with the drug level of the action that's appropriate. Like you wouldn't want to take a medication that's going to get them sleepy at a time right before they're going to drive somewhere. So that's the other issue that they have to talk with. You also need a recording system. There needs to be a way that they can monitor that they've taken their medication. That might be as much as a checklist on their medications, or just one of the little pill packs with the pills, and they have them all different types. They have them 3 or 4 times a day, or daily, or night and day. So that might be a way. You also need to have a discussion about access to financial resources. Do they have insurance? Do they not? The medication, is it come in generic, or is it totally brand name, which is more expensive? Any associated equipment that goes along with that, like if they need oxygen, well, there's equipment associated with that, and so therefore to be able to receive that oxygen, they need that equipment. Or if they're going to get TPN, total parenteral nutrition administered at home, well, then there's pumps and things like that that need to be available to have that done correctly. So you need to also work with a development and a support of a backup system. What happens if I can't do this? What do I do then? So there has to be that discussion. And community resources. There's a lot of community resources out there for patients that have issues. One that comes to mind for recent history, Plavix is a medication that a patient that has had stents must be on for a period of time. And it's been a drug that's not been generic. It's been in it's brand name still. It's just now coming over to a generic, which is a good thing for many people. But it's also a very expensive medication. And if they didn't have his insurance, well, then how are they going to accomplish this? Then there's community resources out there. There's drug companies that will help interact and help meet some of those needs. So you just need to be aware of what's available in your community to help your patient. Then we get to, now that we've implemented, we've done all these things, our evaluation. So now we go to look, what's our progress? And is our goal achieved? And did we achieve this goal? And if not, why? What do we need to reassess and continue on? So we start the process over. So we need to determine need for follow-up, referral to community services. What do we need to make this plan? So it cycles again, so we have to reassess and plan and then implement and then reevaluate again. So question number 1. Which of the following is correctly written goal? EZ will administer the prescribed dose. B, EZ will learn to administer insulin. C, EZ will know how to take insulin correctly. D, EZ will independently administer prescribed dose of insulin at end of 1 hour of instruction. It's pretty easy. It's D. Remember, you have to have all the parts of the goal to get to there. Your plan. Practice question number 2. All of the following statements are true about over-the-counter products except they delay diagnosis, they are expensive, they may mask symptoms, they may have placebo effects. And the answer is B. the thought is that they are least expensive. All right. Thank you again. We have now finished unit number 1, parts 1 through 4, and I'll see you next time. We'll do unit number 2. Thanks. Bye. Be sure to call me if you have any questions. Leave me an email first, and I'll get back to you. Bye.